Okay, hello, my name is Roxbury Lipa. I'm a FNP student in William Patterson University. I have Danielle here, who's a 17-year-old female, for her GIGU assessment. She's here for a well visit. Chief complaint, no complaints. We're gonna go through the subjective assessment, which is basically asking her for her history as far as dietary habits. You eat a well-balanced diet with regular meals and adequate hydration. Any nausea, vomiting?
No.
So no nausea, vomiting. What about your regularity as far as your bowel movements?
Daily, at the same time, every day.
Perfect. Any diarrhea or constipation?
No.
Okay, good. And then any abdominal pain?
No.
Okay. And then as far as like gas, bloating, or masticating or swallowing issues? Okay. Now, as far as GU, the genital urinary system, you're frequently urinating regularly as well? Perfect. Any discomfort?
No.
Okay. And any changes with your urine as far as smell, clarity? Okay. And what about continence? Are you able to hold your urine and no issues with going to the bathroom at night?
No.
Got it. Okay. Perfect. And then no leakage or anything like that? Okay. As far as your menstrual history, when did you first have your menstrual cycle?
I think I was 13.
13 years old. Got it. Okay. And any sexual activity?
No.
Okay. Got it. So for Danielle, no past medical history. She reports no family medical history also as far as gastrointestinal or genital urinary is concerned. Any allergies to medication or food?
Just penicillin.
Got it. Are you taking any medications at the moment?
No.
Perfect. Okay. Social history, any smoking, any drinking?
No.
Okay. As far as we know, she has a good support system of friends and close family members. She, as you can see, she frequently exercises and goes to the gym. As far as diet, you never skip breakfast. A lot of the times you do a protein-based meal. You're a very healthy eater, and no problems with digestion or anything, correct?
Yeah.
Okay, got it. All right, like we had mentioned, her last menstrual cycle was back when you were 13. Okay, and she comes from a good family background. Her parents are home. They're both retired, but they were previously working. And she also has a sister. Their family dynamics are pretty much beautiful. Okay, and there are no parental concerns. Your vaccination status, you're pretty much up to date?
Yes.
Okay. And like we had mentioned before, she has no complaints of pain. Vital signs, she is 5'2", 140 pounds. Your blood pressures have been great, 110/68. You run on the lower side as far as your heart rate because you're an athlete. You're from anywhere from 40 to 50, correct?
Right.
Okay. And pulse ox was 99%, temperature was 98.5. Okay. Any questions so far?
No.
Okay. So I'm gonna go ahead and wash my hands. I'll let the patient know that I'm here. I'm going to be performing the assessment, which is the physical assessment part. But first, we want to make sure that we ask for consent. Is it okay if I go ahead and do my physical assessment with you? Okay. Can you tell me your name and your date of birth?
Danielle Burrell, 10/13/87. Oh, well.
17 years old. Okay. Can you tell me today's date?
March 16, 2025.
Perfect. Okay. As you can see, she is awake, alert, oriented times 3. Patient is calm, comfortable, cooperative, speech is clear. Patient maintains eye contact. As you can see, she does wear glasses. Well-groomed, very well-nourished. No signs and symptoms of acute distress. Skin is clear, even and intact. So far, from general inspection, the assessment is going well. Okay, now we're going to move on to our GI assessment. Would that be okay?
Yes.
Okay. From inspection, I'm going to actually have you lay back a little bit here. Okay. Okay, and if that's okay, I'm gonna lift up your shirt. All right. Basically, from inspection, we want to observe the abdomen for symmetry, any bulging or anything like that, distension, skin abnormalities, or visible masses. And as you can see, everything has been evenly equated. Nothing out of the ordinary is coming out to me. If there were, of course, we would point that out. Now I'm going to move on to auscultation of the abdomen, okay? We want to auscultate first before we do any palpation or percussion, because palpation and percussion could potentially skew the results that we might have with our bowel sounds. So what I'm going to do here, I'm going to take a listen with my stethoscope. I'm going to listen to all 4 quadrants. Usually we take, if I'm not mistaken, 2 minutes altogether on each quadrant. I want to make sure that our stethoscope is warm. Okay. So audible vowel sounds. There's no any sounds that are adventitious or anything like that. There's no what do you call this? Turbulence or anything like that. Now we're going to go ahead and move on to listen to the abdominal aorta using the bell of the stethoscope. Okay, expected findings, no bruit. Now we're going to go through the renal arteries, left and right. And now we're going to listen to the iliac arteries, left and right. Okay, no bruits as expected. And now we're going to go ahead and do our percussion. We want to be able to percuss the areas with gas to have tympanic sounds versus dullness over the solid organs. So from here, we're going to percuss. As you can see, areas of where there's tympany indicates gas, and where there's dullness, there's solid organs, such as the spleen or the liver. Whereas in the intestines, there will be gas because it's hollow. Now we're going to move on to palpation. First, we're going to do light palpation to assess for tenderness, guarding, or rigidity. From light palpation, we don't feel anything. Any pain as I'm doing this?
No.
We're not feeling any masses or organ enlargement. Now for deep palpation, we are expected not to feel the liver or the spleen. The liver possibly, depending on age, but the spleen on the right upper quadrant, you're not expected to feel anything. And if you were, that would indicate splenomegaly. Any pain there?
No.
Okay. And then now we're going to test for rebound tenderness. What I'm going to do is just going to sort of deeply palpate the abdomen and see if it elicits any pain. Okay, I'm going to go ahead and press on your abdomen. You tell me if there's any pain.
No.
Okay, perfect. Now the other assessment that we're going to do is for appendicitis, Murphy sign. Basically, I'm going to have you inhale, and then I'm going to press on your lower quadrant here And then you're gonna tell me if there's any pain.
No.
Okay, so negative for Murphy sign. And the other assessment we have is the obturator sign. I'm gonna have you lift up your right leg. Okay, lift it up, flex like this, and then move it towards the umbilicus and see if it elicits any pain. Any pain?
No.
Perfect. All right. Now we're gonna move on to our GU assessment. For a GU assessment, we have a female patient. As a male provider, I would typically have their parent, or I would have a chaperone, and of course we would have to have consent if they're okay with going through with this assessment. But for purposes of this assignment, basically, we're gonna ask her the questions and we're gonna tell you the expected findings. Upon inspection, we observe for any redness, swelling, lesions, or abnormal discharge. Expected would be no abnormalities, no irritation or discharge. The labia majora should be symmetrical, well formed, and it covers the labia minora. Smooth skin, no lesions, ulcerations, and discharge. This could also be incorporated when we ask the patients the question, of course, age appropriately. As far as palpation, we want to make sure that the bladder and the kidney, there's no tenderness. Of course, that could be troublesome if there were. We could also assess for the CVA tenderness. What I'm going to do is I'm going to have you sit up. Okay? And from here, we're going to locate the costovertebral angle. And we can also percuss and see if it elicits any pain. Did you have any pain?
No.
Okay. The CVA does not have any pain, which means there's no risk for pyelonephritis. All right, and she is 17 years old, so she is currently Tanner stage 5. By age 17, typically, you have breast development, pubic hair, axillary hair, and like we had mentioned before, regular menstrual cycle. As far as the ICD-10 code for this visit, it is Z00.129 for a well-child visit. For her age, anticipatory guidance, continued annual health screenings, healthy behaviors that like what she's doing now, eating habits, exercise, avoiding drugs and alcohol. Also, as a 17-year-old driving, we don't want to have her risk any motor vehicle accidents. So safe driving, of course. And of course, if it gets to that point, sexual behavior, we want to make sure that she is practicing safe sex and being aware of pregnancy prevention. That concludes my assessment. Thank you so much. See you later.